Hi, everyone. This is Betsy Wurzel, your host of Chatting with Betsy on Passionate World Talk Radio, where our mantra is to educate, enlighten, and entertain. Folks, I have such a phenomenal guest on today. The book, I just want to say right off the bat, the book Saving Grace by Dr. David Alfery, that's Alfery, should be read by everyone, but especially those going into the medical profession, because it will teach you some valuable life lessons. And I want to tell you about my guest, Dr. David Alfery, today. Dr. Alfery has served as the Chief of Anesthesia, President of the Tennessee State Society of Anesthesiologists, and was a founding member of Anesthesia Medical Group, one of the largest anesthesia practices in the United States. For 20 years, he served as an oral examiner for the American Board of Anesthesiology, ending his tenure as a senior examiner. Dr. David Alfery holds an academic appointment at Vanderbilt University Medical Center as adjunct associate professor of anesthesiology. Dr. Alfery has authored 10 chapters in medical textbooks and 41 peer-reviewed articles in anesthesia medical journals. Dr. Alfery invented several anesthesia devices for which he has been awarded 17 U.S. and international patents. Wow, that's amazing. And Dr. Alfery also did work with the wonderful organization Operation Smile. And Dr. Alfery worked as a CardioThoraic Anesthesiologist, which I never heard of until I read Saving Grace. But the book is Saving Grace, What Patients Teach Their Doctors About Life, Death, and the Balance in Between. And I want to welcome the wonderful Dr. David Alfery.
Wow, that's quite an introduction. I'm so happy to be here, Betsy. Thank you for having me on.
Oh, you are welcome. I am honored, and it is a pleasure. Doctor, I say out of habit, Dr. Alfery, David. I'll call you Dr. David. First, I have to talk about about your cover. The cover to me is just so touching because it's a picture of, and you could tell, an older person wearing a white coat, doctor, holding somebody's hand. It looks like a younger person's hand. Can you tell us about the cover of the book?
Yeah, this cover was envisioned by my nephew, who's a great artist, and he makes movie posters and hugely successful. He did The Lion King, Avengers, Stranger Things, I mean, just this long list of movies. And he envisioned this picture. And I love the idea because it really I think it speaks a lot of the medical profession, that we are there to take care of and comfort people. The picture itself is my hand, and I enlisted the help of my daughter to be the hand underneath, and the picture is taken by my son-in-law. So sort of a family affair, and I couldn't be happier with the cover.
I really love the color. I mean, the cover, and I like the colors too, because it's just very, it just grabs you. I mean, it grabbed me. That's my opinion. Your title, Saving Grace. When I think of saving grace, right away I think of the Bible and grace, yes. God's grace. So how did you come up with that title?
Yeah, a part of it is God's grace, that there are things, and I describe one in the book, that just absolutely defy any logic, that a patient has everything stacked against them and somehow beats the odds. And, some people might say, well, gosh, I can't believe all of those coincidences happened. But to me, it's an act of grace that patient would live. It also, the fact that there's a lot of tragedies in medicine and in life, but usually you can find some good in them, some silver lining, some saving grace. And then especially I describe a patient in the introduction who is a young girl and just graduated from high school, and she'd been terribly burned in a car accident. And I helped take care of her for a couple of weeks until she passed. But she was just so grievously injured that, and her name was Grace, that, as I say, no matter what we did, no matter how hard we tried, no matter how hard she fought, there'd be no saving Grace.
Wow, that's powerful. Yes, that was quite a chapter. Yeah, that was quite a chapter.
I have to tell you, there are things that happened in my career, and I think in everybody's career in medicine, that are really powerful, and we put them away in a little box, and we always have that box. And when we go and open that box, it sometimes gets really emotional. So I hope I keep my composure here. But
Listen,
some of these are really hard to talk about.
Oh, you know what, Dr. David, on this show, this is real. I get clipped many times on my own on my own show. I mean, I tell people, hey, what happens happens. We're human beings. I know we're entitled to be emotional, so it's fine. It's perfectly fine. I have to. That was a powerful chapter. I mean, all your chapters in your book are so powerful and touching. But this young girl, Grace, who was severely burned and just would be following you and other people with her eyes, so heart-touching. And you're right, there's circumstances with no matter what a doctor does for you, sometimes there's just no making it through. And I have experienced that on a personal level. I have to ask you, so the audience would know, I didn't know there was different types of anesthesiologists. So what is a cardiothoracic anesthesiologist? Well, when you do your anesthesia training, you've got an internship and then 3 years of residency. But a lot of people will subspecialize after that. Cardiothoracic is specializing primarily in cardiac operations and the anesthesia for cardiac operations, but also anything that happens in the thorax, lung surgery, opening the chest to operate on the esophagus. So it's basically a cardiac anesthesiologist. And there are other specialties within anesthesia. There are people that just do obstetrics, that do pain. You can specialize in pediatric anesthesia. In these days, more and more of your care is done by a specialist. If you go to a pediatric hospital, without a doubt, that anesthesiologist has done a pediatric anesthesia fellowship. You know what, Dr. David, I have to tell the audience this. Folks, you need to be very grateful for your anesthesiologist because to me, in my opinion, you are the most important person in the room. You're putting me to sleep, and I'm as close to death while still being alive. And I would always tell the anesthesiologist when I had surgery, make sure I wake up the same way I went in.
Well, when we would have patients that were really anxious, I would try to, tell them about the safety of anesthesia, and I always ended by saying, and just remember, we only charge for waking you up. The going to sleep part is for free.
Oh, that's funny. I really, it always fascinated me, anesthesiology, on how the CRNAs know, and the physicians, how much medication to give to each person to keep them under for so many hours. Like my dad had a 10-hour operation. That's a long time to be under anesthesia. Like it is an art and a science, like you said in your book.
Yeah, it is both, and there's a lot more of the art than people would realize. The science is knowing the drugs and knowing how they interact and how a drug is metabolized and so forth. But the art is putting it together. It's a lot easier now than it was 20 or 30 years ago, and that we have much more sophisticated monitoring of our patients. We even have some level of consciousness monitors that are sort of taking a processed EEG and giving us an idea of how unconscious the patient is. So it's getting to be more and more science every day, but it's really a combination of the two.
That always fascinated me. It really did, because when someone has a 10-hour operation or 40-minute operation, and people are different weights and heights, it just always fascinated me. And I always, but I would also tell the doctor, please give me something for nausea. Back in the old days, the sodium pentothal.
Yes.
Yeah, that didn't go well with me.
Yeah, that's one of the most common concerns of patients. If you ask, what are you concerned about with your anesthesia and with your surgery, the two things that patients will say more than any other is waking up with pain or waking up with nausea. So most patients get anti-nausea medicines routinely under anesthesia, just because it's so unpleasant and it's so easy to treat.
That's good to know. I have to ask you, what motivated you to write this wonderful book?
Oh gosh, what a great question! And I'm not even sure. I think I think it was really a matter of having had so many amazing experiences, as all people in medicine do, and thinking about them and what they meant to me, and realizing that nobody had ever written about the things that I write about. And I looked to see what had been written by other anesthesiologists, and no book had ever been written that really describes this hidden world that I worked in from the standpoint of the person sitting at the head of the table giving you your anesthetic. And that's pretty amazing, because, general anesthesia is first discovered in 1847 and is considered by many to be the most significant advance in medicine in the history of ever. So I thought, well, I'm going to tell the story of anesthesia and what we do. And as I wrote it, it was a lot about what I did. It sort of had to be about me. But over time, it became far more about the patients than it was me. And it's almost as though I'm a kind of a bystander in these stories, because they're really about what patients experience, and through their experience, what they teach us. Yes.
I'm sure in your many years of practice, you learned quite a bit about your patients. You tell about a story when I believe you were in medical school, and you were working on a body cadaver, and your professor said to treat the bodies with dignity. And can you tell about the lesson that you learned from that? Because that is so powerful to me.
Yeah, this is my very first day of medical school, my very first class, and my very first test. And the test was on dignity and treating a patient with dignity, whether they're alive or whether they are dead. And I was like a lot of young medical students, excited with what I was going to do, a little bit puffed up. I'm going to be a doctor, and pretty much wrapped up in my own world. And most of us hardly even heard the admonition to treat this cadaver with respect. We just wanted to get in there and dissect it and learn the anatomy. And it's only through the lens of age that I can look back at that and say, you failed that test. You should have really listened to that professor, because what more precious gift can a person give than their body to science, for others to learn from? And that has been a real problem in medicine with anatomy, where now a lot of medical schools will have a ceremony for the cadavers before the anatomy class starts to really impress on these kids that, look, this is a real person lying in front of you. Be grateful for the gift that they have made for your education.
Yes, I think that everyone should be treated with respect and dignity. I always treated my patients how I would want my family members to be treated. And I think that, unfortunately, through years, that people get complacent or they just, get where they don't want to feel as a way to protect themselves. As I'm sure, many physicians, I know you have it in your book, that you go home and you think, well, what could I have done different?
Yeah, there's a lot of second guessing. For all the being puffed up about becoming a doctor, you get beaten down pretty quickly because there are so many failures and so many situations that no matter what you do, no matter what the team does, it's not going to have a good outcome. So it's a really humbling profession. One of the things that has been really gratifying to me, having read the book and having a lot of physicians read it and healthcare workers, was I tried to emphasize that what we do with patients is actually a privilege that society bestows on us, and the patients bestow on us this unbelievable honor of them placing their life in our hands. And we should treat every patient as it's a privilege. And I've had physicians contact me and say, David, I just needed to be reminded of that.
Yes,
really
I think you said
that's been grateful.
Yeah, that is, and I think you said something somewhere in your book is like, the doctors work for the patient. You're there for us, or we're there for you. I mean, we're there.
My daughter's a child psychiatrist, and when she was going through school, I said, Jana, you're going to see the kids are going to make a transition, and it's a really important one, where you stop thinking that the patient's there for you, and you realize that you're there for the patient. And, of course, not everybody makes that transition, but if you do, I think it makes your career so much more powerful and so much more rewarding that you're there really to serve the patient and really just to take care of them.
Yes.
I like to tell people. Yeah, I just want to add, in the operating room, there's only one person that's important. It's not the surgeon, and it's not you. It's the person lying on that operating table. And that's got to be the center of your practice.
Oh, absolutely. And I could just tell by reading your book, and by the way, you are the first anesthesiologist I have interviewed and whose book I've read. I don't remember ever seeing a book written from an anesthesiologist's viewpoint. I've read about, surgeons and their books, but your book is unique in a way where it is from the anesthesiologist. But Dr. David, all your chapters in this book have such beautiful lessons that your patients taught you. And yes. I know it made you a better person and it made you a better physician. And I just love your book. All the chapters have touched me, but that one chapter, and I didn't mark down what it was. I'm sure you know where your mentor is sewing up this baby who had passed away from the open heart surgery and treated this baby's body with such dignity and respect that it had an effect on you.
Yeah, that's the second chapter. It's called Dignity. And I was first year of my internship, and this little 1-year-old baby had perished with some heart surgery. It was a long, difficult case. Probably went about 6 hours. And when the head surgeon left, the chief resident was there to sew up, and he could have left it for me to do. And I just watched him sew each layer perfectly, bringing the skin together absolutely perfectly, putting the dressing on, just as if this baby was going to go to the recovery room and the ICU and 16 years from now be putting a bikini on. And it was just so powerful to see that it didn't matter that she had died. This is still a patient, and I'm going to treat her with all the dignity that you should. And that never left me. I was so privileged to see some things like that during my career that really helped shape me as a physician. And I think that one of the things that I hope people get from this book is that, we're all the same. We all have the same emotions. We all have the same dreams and frailties, and that we've all hopefully learned the lessons that I describe in these books that the patients taught me, because they're universal. Understanding suffering, understanding gratitude, understanding what it's like to be desperate, and so forth.
Yes, definitely. Dr. David Alfery, I have to have you on again because I want you to discuss the next time you come on about your work with Operation Smile and so many other lessons from your book. And Dr. David Alfery's book is available on Amazon.com. Also, you can reach Dr. David Alfery. He'd love to hear from you at savinggrace.com. Can they order the book on there too?
Yeah, it's savinggracebook.com.
Oh, savinggracebook.com. Thank you. Can't read my own handwriting. Okay. Thank you for that. I wrote it wrong. Savinggracebook.com. So can they get the book there, Dr. David?
No, but there's links to Barnes & Noble and the publisher and Amazon and so forth. There's a written excerpt, a little audio excerpt, and little praise and that type of thing that you normally see on a website.
Oh, okay. So that's savinggracebook.com. It will be in the blog. And I also want to tell the audience, if you have Instagram or TikTok, Dr. David Alfery, that's A-L-F-R-E-Y,
E-R-Y.
No, A-L-F-E-R-Y. Sorry.
The whole world misspells it. A-L-F-E-R-Y. That will be in the blog. It'll be spelled correct in the blog, I promise. You have to go on Dr. Alfery's Instagram. I follow Dr. Alfery on Instagram, and there's so many educational videos that you do on there that I think the public should know about. So I want to encourage the audience. You're welcome to go on there, and you will definitely be educated by following Dr. David Alfery on Instagram or TikTok. And I just can't thank you enough, Dr. David Alfery, for coming on, for writing your book, which is a gift to the world, in my opinion. And, graduations are coming up, folks. Someone going into pre-med, buy this book. I really feel this should be required reading. I really do. This book is just totally awesome and needs to be read. And it will make someone who's not in the medical field really appreciate doctors and especially anesthesiologists. I don't think people appreciate anesthesiologists as much as they should, and this book would be an eye-opener for someone to read. So I want to thank you again, and I want to thank everyone for listening to Chatting with Betsy. It is free to subscribe to Chatting with Betsy on iHeart, Spreaker, Spotify, YouTube. And please read the blog, which will have the information
about Dr. Alfery. And I want to thank Jeannie White, as station manager, Passion World Talk Radio, who writes the blog, produces the show. And I want to thank Lillian Caldwell, CEO, Passion World Talk Radio, who makes this all possible. And please share this show to help other people. This show is to help people to know that you are not alone. You may feel that you're alone, but you're not. I'm here to help you. I'm here to provide resources for you. And the more people I could help, the happier I am. So when you share this show, you are helping someone know about a resource that they might not otherwise know about. I don't do this show for fame or fortune. I do it to help people. I do it my husband, Matt's memory, and get for Clint. And that's my mission, is to help as many people as possible. And you, the listeners, can help me do that. And thank you for listening. Thank you for subscribing, supporting, chatting with Betsy, by sharing and by listening. I am here to help. And you can follow me on my Facebook page, Betsy E. Wurzel, Wurzel. And if you are a caregiver, or most likely you'll end up being a caregiver, I have a support group, #Kick Alzheimer's Death Movement, on Facebook. So that's for caregivers or people who are not caregivers, or if you have dementia of any kind, feel free to join my group so you can know how to advocate and to be educated on being a caregiver, because caregiving is stressful, and I wish I knew resources way back when that I know now, and that's why I want to help people. I know what it's like to be alone, and I know what it's like to struggle, and I know what it's like to be a caregiver. And I don't know everything, but I just talk about my experiences and hope that you don't make the same mistakes that I made. That's what I have to say today, folks. And as I always say at the end of my show, in a world where you could be anything, to please be kind, shine your light bright, because if you did that, if everyone did that, it would be a much brighter, kinder world. This is Betsy Wurzel, your host of Chatting with Betsy on Passionate World Talk Radio. Bye-bye now.